Have you noticed that you're making more trips to the bathroom than you used to? Maybe you've started waking up 2 or 3 times every night. Perhaps your urine stream isn't as strong as it once was. Or maybe you've caught yourself wondering, is this just a normal part of getting older? These are questions I hear from men all the time. The truth is, changes in urination become more common with age, but that doesn't mean they should simply be ignored. Your prostate is a small gland, about the size of a walnut in younger men, located just below the bladder and surrounding part of the urethra, the tube that carries urine out of the body. As men get older, the prostate often changes. Sometimes those changes are harmless, sometimes they require medical attention. And occasionally, they may be the first sign of a condition that deserves prompt evaluation. The good news is that recognizing early symptoms gives you the opportunity to discuss them with your healthcare provider before they become more serious. Today, we'll go through 9 early warning signs your prostate may be trying to tell you something. Some of these signs are very common. Others are often overlooked. And the last one surprises many men because they don't immediately associate it with prostate health. Welcome to Men's Health Today. I'm Dr. Natalie Reid, and every week I share practical, evidence-based information designed to help men over 50 better understand their health and make informed decisions with their healthcare providers. Whether we're discussing prostate health, heart health, nutrition, hormones, or healthy aging, my goal is always the same: to provide clear, reliable information that you can actually use in everyday life. Before we begin, I'd like to mention that this video is intended for educational purposes only. It should not replace professional medical advice, diagnosis, or treatment. If you're experiencing new urinary symptoms, severe pain, blood in your urine, fever, or difficulty passing urine, seek prompt medical attention. Always consult your healthcare provider for advice that's specific to your personal health situation. Let me tell you about someone we'll call Robert. Robert is 67 years old. He's active, enjoys gardening, and rarely misses his morning walk. Over the past year, however, he began noticing something unusual. He started waking up once during the night to use the bathroom, then twice. Eventually it became 3 times nearly every night. He assumed it was simply because he was getting older. He joked with friends that everyone his age spent half the night walking to the bathroom, so he ignored it. Months later, his wife encouraged him to mention it during his annual checkup. His doctor asked several questions, performed an examination, and recommended a few routine tests. Fortunately, Robert's symptoms were caused by an enlarged prostate, a very common condition in older men, and together they developed a treatment plan that significantly improved his quality of life. Robert later told his doctor something that many men say: "I wish I'd mentioned it sooner." That's exactly why we're having this conversation today. Understanding the early signs doesn't mean assuming the worst. It means recognizing when it's time to ask questions and seek medical advice. Let's begin with one of the most common warning signs. Warning sign 1, frequent urination. One of the earliest signs many men notice is simply needing to urinate more often than usual. You may find yourself making extra trips to the bathroom during the day, or perhaps you're planning outings around where the nearest restroom is located. An enlarged prostate can press against the urethra, making it more difficult for urine to flow normally. As a result, the bladder may not empty completely. When that happens, it fills again more quickly, creating the feeling that you need to urinate more often. Of course, frequent urination isn't caused only by prostate problems. It can also be related to diabetes, certain medications, urinary tract infections, increased fluid intake, or other medical conditions. That's why it's important not to diagnose yourself. Instead, think of frequent urination as a signal worth discussing with your healthcare provider, especially if it's new, persistent, or becoming more noticeable over time. The next sign is one that many men dismiss because they think it's simply a weak bladder, but in reality, it can sometimes be one of the earliest clues that the prostate is changing. Let's talk about that next. Warning sign 2, waking up frequently to urinate at night, nocturia. Have you started waking up once, twice, or even 3 or 4 times during the night to use the bathroom? This condition is known as nocturia, and it's one of the most common reasons older men experience poor quality sleep. While many people assume nighttime urination is simply part of getting older, that's not always the case. An enlarged prostate can make it more difficult for the bladder to empty completely during the day. As a result, you may feel the need to urinate more often during the night. Of course, prostate changes aren't the only possible cause. Drinking large amounts of fluid before bedtime, certain medications, diabetes, sleep disorders, heart conditions, and overactive bladder can also contribute to nocturia. That's why it's important to look at the whole picture rather than assuming there's only one explanation. If you're consistently waking multiple times each night to urinate and it's affecting your sleep or daily energy levels, it's worth discussing with your healthcare provider. Better sleep often begins with understanding what's causing the interruptions. The next sign is subtle. Many men don't notice it until it gradually becomes part of their daily routine. But once you recognize it, you'll understand why it deserves attention. Warning sign 3. A weak or slow urine stream. Think back to when you were younger. Your urine stream may have started quickly and flowed with good force. Over time, some men notice that the stream becomes weaker or slower. Instead of flowing steadily, it may feel as though it lacks pressure. An enlarged prostate can narrow the urethra, making it more difficult for urine to pass freely. The bladder then has to work harder to push urine through the narrowed passage. A weak urine stream doesn't automatically mean there's a serious problem. In many cases, it's associated with benign prostatic hyperplasia, often called BPH, which is a non-cancerous enlargement of the prostate and becomes increasingly common as men age. However, any noticeable change in your urinary pattern deserves medical evaluation. Your healthcare provider can help determine whether the cause is related to the prostate or another condition affecting the urinary tract. Here's another sign that many men find frustrating. It's not painful, it's simply inconvenient, but it can be an important clue. Warning sign 4. Difficulty. Starting urination. Have you ever stood at the toilet knowing you need to urinate, yet nothing happens for several seconds? This hesitation can be frustrating. You know your bladder is full, but your urine doesn't begin flowing immediately. This symptom is sometimes called urinary hesitancy. When the prostate enlarges, it can partially obstruct the urethra, making it more difficult for urine to begin flowing. Over time, the bladder muscles may also become strained from working harder to overcome that resistance. It's important to remember that urinary hesitancy has several possible causes, including certain medications and neurological conditions. That's why proper medical evaluation is essential, rather than trying to diagnose yourself based on a single symptom. If you've noticed increasing difficulty starting urination, especially when combined with other symptoms we've discussed today, don't ignore it. The earlier the cause is identified, the more treatment options are often available. We've now covered 4 of the most common warning signs, but the next 3 are the ones that many men tell me they never expected to be related to their prostate. One of them can leave you feeling as though you've just been to the bathroom. Yet moments later, you feel like you need to go again. Let's take a closer look. Warning sign 5. Feeling like your bladder never completely empties. Imagine you've just finished using the bathroom. You wash your hands, leave the restroom, and only a few minutes later, it feels as though you need to go again. Many men describe this as the uncomfortable feeling that their bladder never completely empties. This sensation can happen when urine remains in the bladder after urination, sometimes because an enlarged prostate partially blocks the normal flow of urine. When the bladder isn't emptied fully, it fills more quickly, leading to frequent trips back to the restroom. Over time, constantly working harder to empty the bladder may place additional strain on the bladder muscles. That's one reason it's important not to ignore persistent symptoms. The good news is that your healthcare provider has several ways to evaluate what's happening. Depending on your symptoms, they may ask questions about your urinary habits, perform a physical examination, or recommend tests that measure how well your bladder is emptying. You don't have to simply accept this as part of aging. If you've noticed this feeling becoming more common, it's worth bringing up during your next medical appointment. The next warning sign can be especially frustrating because it often seems to appear without any warning at all. Warning sign 6. A sudden, urgent need to urinate. Have you ever been driving, shopping, or enjoying time with family when you suddenly felt an overwhelming need to find a bathroom immediately? That sudden, difficult to ignore urge is called urinary urgency. For some men, it feels as though the bladder sends a powerful signal with very little warning. Urinary urgency can occur for several reasons, including bladder irritation, certain medications, urinary tract infections, or changes involving the prostate. When the prostate enlarges, It may affect how the bladder functions, making it more sensitive and creates the sensation that you need to urinate right away, even when the bladder isn't completely full. Some men begin planning every outing around restroom locations. Others avoid long car rides or social events because they're worried they won't find a bathroom in time. If this sounds familiar, know that you're not alone. More importantly, you don't have to suffer in silence. Many causes of urinary urgency can be evaluated and, in many cases, managed with appropriate medical care. The first step is simply starting the conversation with your healthcare provider. The next sign may seem minor. In fact, many men never mention it because they assume it isn't important. But combined with other symptoms, it can provide another clue about how the prostate is functioning. Warning sign 7, dribbling after urination. After you finish urinating, do you sometimes notice a few extra drops even though you thought you were done? This is commonly called post-void dribbling. While occasional dribbling can happen to men of any age, it tends to become more common as men get older. Changes in the muscles around the urinary tract, along with prostate enlargement, may contribute to this symptom in some individuals. Although dribbling itself isn't usually dangerous, it can be frustrating. It may lead to damp underwear, discomfort, or embarrassment. Because many men feel uncomfortable talking about urinary symptoms, they often keep these experiences to themselves. But your healthcare provider discusses these issues every day. There's no need to feel embarrassed. In many cases, simple lifestyle changes, pelvic floor exercises, medications, or other treatments may help, depending on the underlying cause. Remember, the goal isn't to diagnose yourself from a YouTube video. It's to recognize changes in your body and know when it's appropriate to seek professional advice. When Robert finally spoke with his doctor, he was surprised by one question. How long have these symptoms been bothering you? He paused for a moment before answering. Probably more than a year. His doctor smiled kindly and said, "You're not the first man to wait that long. In fact, many men delay talking about urinary symptoms because they feel embarrassed or assume nothing can be done. But the earlier these changes are evaluated, the sooner you and your healthcare provider can decide whether they simply need monitoring or whether treatment might improve your quality of life." We've covered 7 important warning signs so far. The final 2 are less common, but they're also the ones that should never be ignored. One of them may require prompt medical attention. Let's finish with the 2 symptoms every man should know. Warning sign 8, blood in the urine or semen. The next warning sign is one you should never ignore. If you notice blood in your urine or blood in your semen, it's important to contact your healthcare provider as soon as possible. While blood isn't always caused by a serious condition, it's never considered a normal finding. There are many possible explanations: urinary tract infections, kidney stones, an enlarged prostate, inflammation of the prostate known as prostatitis, and in some cases, cancers affecting the urinary tract or prostate. The important thing is this: you cannot determine the cause simply by looking at the color of your urine or by waiting to see if it happens again. That's why medical evaluation is so important. Your healthcare provider may recommend urine testing, blood tests, imaging studies, or referral to a urologist depending on your symptoms and medical history. If you ever notice visible blood, don't panic, but don't ignore it either. Prompt evaluation is always the safest approach. The final warning sign may seem like an ordinary infection, but when it continues or keeps returning, it deserves a closer look. Warning sign 9, pain or burning during urination. Most people associate burning during urination with a urinary tract infection, and that's certainly one possible cause. But pain or burning can also occur with inflammation of the prostate, bladder conditions, sexually transmitted infections, kidney stones, or other medical problems. If discomfort lasts more than a day or 2, becomes severe, or is accompanied by fever, chills, difficulty passing urine, or blood in the urine, seek medical care promptly. It's especially important not to treat persistent symptoms on your own without understanding what's causing them. The sooner the correct diagnosis is made, the sooner appropriate treatment can begin. Your body often gives you early signals. The key is paying attention to them instead of assuming they'll simply go away. Before we finish, I'd like to leave you with one important thought. Hearing these symptoms can sometimes make people immediately think about prostate cancer. But it's important to remember that most urinary symptoms in older men are not caused by prostate cancer. In fact, one of the most common causes is benign prostatic hyperplasia, or BPH, which is a non-cancerous enlargement of the prostate. That's exactly why it's so important not to jump to conclusions. Instead, pay attention to changes in your body and discuss them with your healthcare provider. They can determine the underlying cause and recommend the most appropriate next steps. Early evaluation doesn't just help identify serious conditions when they're present. It also helps reassure many men when the cause turns out to be something common and treatable. Let's quickly review today's 9 warning signs. Frequent urination, waking up several times during the night to urinate, a weak urine stream, difficulty starting urination, feeling as though your bladder never completely empties, a sudden, urgent need to urinate, dribbling after urination, blood in the urine or semen, pain or burning during urination. Remember, experiencing one or even several of these symptoms doesn't automatically mean you have a serious condition, but persistent changes should never be ignored. Talking with your healthcare provider early often leads to better answers, more treatment options, and greater peace of mind. Thank you for watching Men's Health Today. I hope this video has helped you better understand some of the early warning signs that may be related to prostate health. If you found today's information helpful, please consider subscribing to the channel. Every week, I share practical, evidence-based videos designed specifically for men over 50, covering topics such as prostate health, heart health, healthy aging, nutrition, hormones, diabetes, and everyday habits that support a healthier life. I'd also like to hear from you. Have you ever experienced one of these symptoms, or did one of today's warning signs surprise you? Feel free to share your thoughts or questions in the comments below. While I can't provide personal medical advice here, your experiences may help others realize they're not alone. Until next time, take care of yourself, stay informed, and I'll see you in the next video.